during this presentation, you can ask me your questions at any slide, at any moment, because I think it's very useful to ask the question when it arises. Is it clear? Or you can ask your questions at the end of my presentation. So today I will talk about depression and namely its clinical aspects. So today I will cover following aspects of depression, such as burden, clinical definition, symptoms, types, diagnostics, suicidal behavior, assessment and measurement of depression, and therapy of depression. So as you can see, it's kind of more clinical aspects than psychological theories of depression. So what about burden of depression? So you can utter your question or write it in our chat. Okay. So, but I don't see our chat. Maybe Timirlan will inform me when some question will arise. Okay, so there is a very huge study that was conducted in the United States, and it's called National Comorbidity Survey Replication, or NCSR, which was directed to investigate epidemiological aspects of depression. And according to the survey, major depressive disorder was ranked as second for the number of days overall impairment in the United States among all chronic physical and mental disorders. So totally 386.6 million days a year. Talking about clinical definition of depression, according to American Psychiatric Association, namely DSM-5, which means Diagnostics and Statistics Manual 5 on mental health disorders. So mood disturbance is a dominant feature of mood disorders. So and it is known that not known, but main mood disorders are presented by following 5 disorders, such as major depressive disorder, or MDD, disruptive mood dysregulation disorder. This disorder occurs in children no older than 18 years old. Then persistent depressive disorder, or PDD, and premenstrual dysphoric disorder, and other disorders. So when we talk about depression, we usually talk about major depressive disorder. So major depressive disorder includes one or more major depressive episodes, MDEs. So this episode is a separately defined period during which the subject experiences distinct moderate change in affect. or mood, cognitive functions, neurovegetative functions for 2 weeks or more. So this is very important, for 2 weeks or more, with a decrease in the previous degree of functioning. So during my presentation, you can see sources for the information provided on the slide, and in the end of my presentation, I will show you the whole bibliography for the presentation. So what are the symptoms of depression? So symptoms of depression are divided into big groups. One group is core symptoms, and second group other symptoms. So core symptoms are presented by decreased mood, anhedonia, or in other words, it is a loss of getting pleasure from activities that previously brought pleasure. Then the third symptom is decreased levels of vital energy. And then as other symptoms, you can see here decreased appetite, psychomotor changes, sleep disturbances, and feelings of guilt or worthlessness, decreased self-confidence, reduced concentration, and decreased libido. So, according to DSM-5 classification, MDD is divided into three types. Three types of severity. So, mild severity is characterized by the presence of 4 symptoms from the list above, from this list on previous slide, including at least 2 core symptoms, as well as some difficulty in performing everyday activities. So severity of MDD is characterized by the presence of some number of symptoms from the list on previous slide. So moderate severity is defined by the presence of more symptoms, and severe MDD is identified by the presence of at least 7 symptoms from the list, some in severe form, including all 3 core symptoms. So, is it clear for now? Is everything clear? Okay, you can ask questions. You can ask questions at any time, okay? At any moment. So, another well-known classification of depression is characterized by the source of depression. For example, in endogenous depression, depression is caused by endogenous factors such as disturbance of the neurotransmission process. And in this type of depression, in endogenous depression, in the treatment of this type of depression, antidepressants can be used. So it is the most effective therapy in this type of depression. When antidepressants are not effective enough, so Another option may be electroconvulsive therapy. But as I know, in our country, in Kazakhstan, this type of therapy is not used. We don't have such psychiatric departments or clinics which have this type of therapy. So I know that in Western countries, even in Russian Federation, this type of therapy is used. Okay, next type of depression, exogenous depression. So in this type of depression, some life stressors play a role, such as job loss, divorce, or physical trauma. And so another name of this type of depression is reactive depression. And here psychotherapy will be effective enough, and specialists can treat this type of depression without antidepressants. So how we diagnose depression? The diagnosis of depression could be established by a well assembled psychiatric history and objective examination. And also, symptoms of depression are divided in two big groups: psychological and somatic symptoms. Significant psychological symptoms are emotional symptoms. Which include a decreased mood and anhedonia, as I said before. So another specific symptom could be fluctuations of mood during the day. For example, in the morning, the mood is worse than in the evening, and it's called diurnal change in mood. So in addition to low mood, patients also often experience irritability. So we come to suicidal behavior here. So it's the most severe concern in depressed patients because of mortality and morbidity. And studies suggest that 2% of patients with affective disorder or mood disorders die from suicide. And in patients who have ever been hospitalized due to suicidality, this number reaches 8%. There is a not so-called, but its real name, sad person scale, developed by Prescorn. And here you can see that so the name of the scale is a abbreviation, and each letter refers to some factor. For example, according to gender, to sex, more than 3 males for every 1 female kill themselves. And by statistical analysis, older patients more often than younger kill themselves. A depressive episode precedes suicide in up to 70% of cases. And most people who die from suicide do so on their first or second attempt. Recent onset of ethanol or other sedative hypnotic drug use increases the risk and may be a form of self-medication. So it's regarding ethanol use. Also, significant cognitive slowing, reduce of rational thinking could be found in persons who plan suicidal attempt. Yeah. Next, social support deficit plays also significant role. People who die from suicides always need to inquire about presence of a plan. Sorry. These persons always have organized plan. So O. And N refers to no partner, and so no partner could be a result rather than a cause of the depressive disorder. And the presence of intercurrent medical illnesses. We go further. What is regarding the somatic symptoms of depression? So there are three big groups: sleep disorders, change in appetite, and psychomotor changes. So in these three groups, there could be as decrease in this behavior or increase. So what about laboratory tests? So currently there are no specific laboratory tests that could be used to diagnose depression. And usually when patients arrive to psychiatric clinic, usually urine and blood tests are established, which can show that person has substance use or some toxicity, which can mimic the symptoms of depression. So what is regarding assessment and measurement of depression? There are gold standards among rating scales, and these standards are Hamilton rating scale for depression, the Beck depression inventory, and the inventory of depressive symptoms. So the purpose of assessing depression is to measure severity of depressive symptoms. And also these assessment tools, measurement tools could be used for a screening. So for example, if our center would like to conduct a big screening and to reveal the rates of depression in students, we can create a Qualtrics survey and use one of these scales to identify the presence of depressive symptoms in students and to create a statistics. So we come to therapy of depression, and as you can see here on this slide, there are four modalities in the therapy of depression. Four big modalities: medications, psychological treatments, physical treatments, and other complementary treatments. So I will talk further in detail about every of these modalities. So there are common provisions in the therapy of depression. So currently, antidepressants are used very often in the treatment of depression because there is a solid evidential base. I mean research evidential base of the use of antidepressants in the treatment of depression. Another type of the therapy, and it could be as a component of the therapy of depression, is education. And for example, now you also listen to this presentation about depression and receive some information about depression. And it is known that when you know your enemy well enough, so you can win. And another provision is that in the therapy of depression, always individual characteristics of the disease of the patient are taken into account, taken into consideration, as well as the availability of the treatment and the patient's personal preferences. So good psychiatrists, good psychotherapists will ask you, for example, or a patient, what this patient prefers for the as a treatment, and will consider his or her individual characteristics, personal characteristics, and characteristics of his depressive disorder. So there are two main types of psychotherapy that have solid evidential base in the use as a therapy for depression. They are interpersonal psychotherapy, or IPT, and cognitive therapy. And interpersonal psychotherapists will identify interpersonal difficulties in patient's life, and will help to establish good interpersonal connections, and which will cause psychological support for the patient. So cognitive therapy was developed by Arenov, and in this type of therapy, therapist identifies automatic thoughts and behavioral patterns, and these automatic dysfunctional thoughts will be re-evaluated and changed during the therapy. And the usual duration for both IPT and cognitive therapy is 3-4 months with 12 or 14 sessions. Also, there is a specific therapy, psychotherapy, called mindfulness-based cognitive therapy. And this type of therapy was initially created especially for treating depression by Siegel, Williams, Teasdale in the early 90s. And MBCT is conducted as an 8-week course with a frequency of classes once a week. And a core skill that is developed during MBCT training is mindfulness. And I'm planning to prepare other additional sessions, webinars about mindfulness and mindfulness-based cognitive therapy during this semester. So please please watch for announcements about upcoming webinars. So according combination treatment. What is combination treatment? Combination treatment is the combination of psychotherapy and pharmacotherapy, and it is indicated when one particular treatment is partially effective by itself, or when we need to achieve two separate goals of therapy. Because, for example, pharmacotherapy can help us to reduce depressive symptoms, and psychotherapy could help to find a solution to social or occupational problems. So another option is when a patient has a history of depressive disorder with a chronic course, and often this type so often these patients experience partial efficacy of pharmacotherapy, and addition of the psychotherapy will be effective in these patients. And other options. So Myberg, in his study at 2003, argues that pharmacotherapy and psychotherapy target different brain structures. So he claims that psychotherapy causes top-down effects and pharmacotherapy provokes bottom-up effects. What does it mean? So these top-down and bottom-up terms are so they came from neuroscience, and as you may know, our brain consists of white matter and gray matter, and gray matter, it's our cortex, so our higher psychic functions, and white matter is white matter lays under. So we have gray matter and white matter, and top down effects means that using psychotherapy we can affect our cortex, our consciousness through the language, through the through the speech therapy, and then there will be top-down effects. So this will affect our white matter through the gray matter, and vice versa. Vice versa regarding pharmacotherapy. So, and Myberg suggests that combination treatment for depression can be mutually reinforcing. So, physical treatments and other complementary treatments left, and I will not cover electroconvulsive therapy and brain stimulation techniques in my presentation, but because it will not be useful for you. Yeah, because as I said before, electroconvulsive therapy is not used in Kazakhstan, and it is a specific type of therapy that is used for so-called difficult patients with a chronic course of disease. And brain stimulation also, it's a very I will say rare technique, which is used maybe only in some research centers around the world. For example, I know that Hanover Neurosurgery Center in Hanover Medical University use this technique, brain stimulation technique, for treating severe obsessive compulsive disorders. And so they make a surgical operation, and they use special electrode that goes into the brain, and this electrode stimulates deep structures in our brain. So you can see on this slide the photo of this lamp. So this photo is so I have this lamp at home, and now this lamp gives light. And what is phototherapy? So this lamp costs about maybe 30 euros. So you can find it on, I think, AliExpress or eBay. What is phototherapy? Phototherapy was developed for the treatment of the seasonal affective disorder. What is seasonal affective disorder? It's a disorder which occurs during late autumn and winter, when we experience a lack of sunlight, yes, and so these lamps can give light which comparable to sunlight. And there are many studies conducted which show that phototherapy can be used for treatment for the treatment of several types of depression, premenstrual, antepartum depression. So yeah, the effectiveness of phototherapy may be could be explained by the normalization of biological rhythms. So, what we can say about complementary and lifestyle treatments? I think it's very important slide for you because all of these treatments you can use by yourself. For example, aerobic exercise in the amount consistent with public health guidelines is an effective treatment for mild to moderate major depressive episodes, according to Friedman. Blumenthal goes further and claims that the effectiveness of exercise in general can be comparable to treatment with antidepressants. It's a very, I think, not brave, but so yeah, it's very serious claim, I think. So all of us can use this method, this type of treatment in our life, and improve our quality of life. Yes, we can improve our level of mood. Another treatment is Hypericum perforatum plant extract, or in Russian, зверобой продырявленный, or also another name of this plant is Saint John's plant. And this plant extract has been shown to increase serotonin production in several clinical studies and be effective in treating mild to moderate depression. Also, so this plant extract you can buy in pharmacies in our city, or like in other Kazakhstani cities. You can ask for tablets with зверобой продырявленный, and this plant extract can work as an antidepressant, but as not synthetic antidepressant, but natural antidepressant. So the third option is omega-3 fatty acids, which include eicosapantenoic acid and docosahexaenoic acid. Yeah, and regarding these fatty acids, for example, Lin et al. Performed a systematic review and meta-analysis, and concluded that these fatty acids, have significant antidepressant efficacy in unipolar and bipolar depression. So, sorry. So my presentation comes to the end, and conclusions for my presentations are following. So depression is a high burden disease, and it can cause significant economic losses, and also it is responsible for the high dropout rate from college, university, and divorce. As I said, there are different types of depressive disorder that are distinguished using standard guidelines. For example, in Northern America, Currently, DSM-5 is used, and in Kazakhstan and in Russian Federation, in Europe, ICD-10 is used. ICD-10, so abbreviation means International Classification of Diseases, 10th edition. So when we talk about depression, we talk usually about major depressive disorder. So the core symptoms of major depressive disorder are low mood and anhedonia. The diagnosis of depression could be established only by a specialist, by a doctor, by a psychiatrist. I know that in Western countries also family doctors can establish the diagnosis of depression and can prescribe antidepressants as psychiatrists do. So the laboratory tests do not play a role in the diagnosis of depression. Also, there are several measurement and evaluation scales for measuring the severity and the presence of symptoms of depression. And there are gold standards among these scales. And as I presented, there are different directions in the treatment of depression. And nowadays, the antidepressants are the most used or widespread widespread treatment in the therapy of depression. The leading group of antidepressants today are serotonin, selective serotonin reuptake inhibitors, SSRIs. As psychotherapy, there are two main directions: cognitive therapy and interpersonal psychotherapy, which have a solid evidential base. But here, I wanted to say that, for example, psychologists of our center use, for example, Gestalt therapy, psychodrama, art therapy, and so this doesn't mean that Gestalt therapy or psychodrama are not effective enough for treating students or clients with depressive symptoms. So they are also effective, and they also have evidential base, but according to several studies, IPT and cognitive therapy, which I think due to the age of these therapies, they have more solid base. Yeah, and we also, I mean, we specialists who deal with depression should use an individual approach when treating patients with depression. So I can leave this slide for you, so you can read these sources if you want to know more about depression Maybe you liked some sources, maybe you liked some slides,